Today on Best Care with Bestmed Medical Scheme, we're delving into a topic that will ensure you don't make any rash decisions regarding the health of your little ones. We are discussing mumps and measles. Welcome back, Dr. Coopoo.
Thank you so much for having me.
What are mumps and measles, and why should parents be concerned about them?
Okay, both mumps and measles are viral infections, and they are infectious conditions that kids will catch from each other. Measles is a condition that causes a rash all over the baby's body, usually fine pimples. They also get what I call the 3 C's. So that's cough, coryza, which is another word for cold, and conjunctivitis, where they'll get pink eyes. Mumps is a condition that affects the salivary glands. So your child may have swollen salivary glands, their cheeks may look a bit fuller. So those are the main differences.
Explain to us a little bit more, what is a viral infection?
So both viruses and bacteria are microorganisms that can cause infection. So a virus is usually smaller than a bacteria, and it infects the body in a different way, but usually causes the same symptoms.
When should parents start thinking about vaccination, especially for mumps and measles? And is there a recommended schedule?
Sure. So vaccinations are a part of a schedule, both in the private and public healthcare system. In private, a vaccine called the MMR, measles, mumps, and rubella, is available, and that is given at between 12 and 15 months, and then your child needs a booster around 4 to 6 years. In the public healthcare system, we just have measles, unfortunately no mumps and rubella, and that's given at 6 and 12 months.
How can parents recognize the symptoms? And if they do suspect there is an infection, any advice on that to help our parents?
Sure. So the symptoms, as I mentioned, are usually a fever. Your child feels miserable. They may have a loss of appetite. Specifically in measles, they have their rash and the 3 C's. And in mumps, they will have swollen cheeks and feel pain when swallowing. Those are the main differences.
Is there any advice you can give parents if they suspect or there is an outbreak of mumps and measles in their community?
Okay, so firstly, if your child is the one that has mumps or measles, you have to make sure that they are isolated. So don't let them go to school, and keep them away from others, especially younger children, pregnant women, and the elderly. Next, you need to follow your school's advice in terms of whether to keep your child home or not. Keep up to date on the news in terms of what's happening with the outbreak, where the outbreak is, and just preventative measures like hand washing and good hygiene.
Anything you can add to that parents can maybe have practical tips on how to prevent mumps and measles in their children at home?
Okay, so prevention's better than cure. Vaccination is key. So make sure that your child is up to date with their vaccines, and the same principles of preventing other infections applies here. So teach your child to wash their hands before and after eating, after playing with other kids, and just isolate your child and keep your child away from other kids that are sick.
That is wonderful advice. Thank you so much for your time and for your knowledge and your guidance and all these amazing tips, Dr. Coopoo. We really appreciate it.
Oh, thank you. It was a pleasure.
To our viewers, just so you know, pediatric immunizations are covered as part of Bestmed's preventative care benefits. This means that these benefits are free of charge and are available on all Bestmed options except for Beat1. If life happens, you need a medical aid that cares. Thank you to Bestmed Medical Scheme for yet another episode of Best Care.